Hi guys, I'm Dr. Iraniha. I'm a board certified general surgeon, and I have been in practice over the last 2 decades in Southern California, Orange County, Newport Beach area. My main interest is minimally invasive surgery, including robotic and laparoscopic operation, and my main focus of the practice is major and complex abdominal wall hernia repair and body contouring. The videos that you're going to see is my experience through bilateral knee replacement. Unfortunately, I have developed bilateral knee arthritis and is associated with the pain and discomfort, and I need to have this type of operation in order to recover and go back to my normal life. And I thought it would be very interesting for people to hear and see my actual experience through this operation for multiple reasons. Number one, it's because of my unique age group that I'm going through this operation. Number two is that I'm going through bilateral knee replacement, and I watched so many videos on the social media, and I didn't see that many people with the bilateral knee replacements and sharing the experience, and I thought might be helpful. And the other last reason is that I'm a surgeon myself, and I deal with patients post-operative pain and discomforts and recovery, and I thought looking at this operation from a surgeon eyes and also a patient perspective might be very helpful, and that's why I'm going to share my experience with you. But again, I'd like to emphasize that I'm not an orthopedic surgeon, and I'm not a certified and licensed physical therapist. So whatever I say in these videos and what you see from my post-op recovery, including my pain medications regimen and also the exercises that I'm going to show you, are not a medical advice. If you have any question or concerns, you definitely need to talk to your orthopedic surgeon or discuss the matter with your certified and licensed physical therapist. is day number 8 after my double knee replacement surgery. Today I woke up and I felt much stronger and feeling better. Yesterday night I still had a little bit of temperature, maybe around 99.3, but went down. I'm still taking Tylenol around the clock, 1 gram every 8 hours, and one anti-inflammatory medication, but I don't have that much discomfort to take any other pain medication. Last night was a little bit better night. I still have trouble falling asleep, so my sleep is very short and I have to move around so I don't get discomfort in my knees, and that makes me a little uncomfortable still at night. But in the morning, woke up and took a shower and actually made breakfast for myself, and I was very independent. I went downstairs and took care of myself and took a shower and actually started doing some minimal upper body exercises that I did without moving my knees and damaging my recent surgery. So I was very careful to isolate my upper body, and I think it made me a little feel better. I did also my routine exercises for my knee that I'm supposed to do. So today I want to talk to you about the how the operation actually works. Now that I'm feeling better, my mind's working a little bit better. Obviously, I'm not an orthopedic surgeon, but the way that the surgery was done for me, that I have a incision on the sort of medial side of my knee going down towards the center, next to my kneecap. And what they do is this type of operation that I went through called muscle sparing surgery or approach, which they would not cut the muscles. They go between the layer of the muscles and push the kneecap with the muscles aside and identify the tibia and femur, and basically clean up the surface that's already was diseased and arthritic, and the measurement is apparently done with a computer, and it has to be very exact, otherwise you get discrepancy between these two legs. So it's done very carefully and with the computer assisted measurement. And then on the femur, there's a little cap that comes over the distal or lower portion of the femur and stick to that area. And then on the tibia, there's another plate with a spike, that the spike goes into the tibia, and there's, in my case, there's also 2 screws that go in and hold that cap on the top of the tibia, which is the leg bone. Between these 2, there's a very specialized plastic that stays there, and that works like a cushion, so when you move your knees, the metal are not moving over each other, and that plastic apparently can last up to 20 years, obviously depending on how much activity I would have after the surgery. There are a lot of restrictions after the operation based on I've heard, but there are people that able to go back to full duty activity and heavy exercise, but obviously that will wear down the implant, or there's increase the possibility of it wearing down the implant in the future. So I'm not thinking about that right now. What I'm thinking about right now is to just get better, and I still have a lot of swelling on my knees, and I'm wearing these high tie TED hose, which creates 15 to 20 millimercury pressure in order to keep the swelling down, and that goes all the way from my toes into upper thigh, and that way it helps to distribute the swelling throughout the legs, so it allows the absorption of the swelling a little bit better. I'm extremely looking forward to have less swelling and have less discomfort and more mobility and movement in the next few days, and hopefully by third week I will be able to do a little bit more activity, at least easily going out or driving. I have not driven any car, but I went to my office with my wife, riding in the car yesterday. So step by step, I'm getting a little bit better, and I think I'm in the right direction. The only thing that bothers me is still that little temperature that I get every day, but because of the significant amount of inflammatory process that I have because of these two surgery on both knee and a lot of swelling and inflammation and bruises, it's very normal, and it happens. When I get that little temperature, I feel a little weak and a little nauseous, but as soon as the temperature go away, I feel a little bit better. So I'm hoping that that will pass next few days, and overall I'm feeling a little bit stronger, and the fact that I started a little bit of work on the upper body make me a little happier, so I don't lose my muscle tone at this moment. So I keep you posted. Bye.